So, Dr. Perlmutter, when we do get carpal tunnel in, and we see them daily in our practice, there's several methodologies for treatment, from conservative to aggressive, which would be surgical. Can you talk a little bit about those and explain those to our clientele?
Sure. Some people come to us with very mild carpal tunnel, which means you haven't lost any muscle in your thumb. There's three muscles in your thumb, and the two on the outside here are controlled by the carpal tunnel nerve. If you're losing muscle there, if you're having skin changes, particularly dry skin in these digits, but not your pinky, and if you have numbness in these digits, but not your pinky, with activities or at rest, particularly if it wakes you up at night, when you hold a steering wheel or a book or a phone for a while, and these fingers only go numb, then it's carpal tunnel. We rate that mild, moderate, or severe. Severe is when you lose muscle. Moderate is if you have skin changes or other findings, particularly if you're losing dexterity. And usually mild or moderate disease gets better with non-surgical treatments, Paul, as you know, and that's most of our patients. But if you really lost some muscle, you really have severe disease. And we help qualitatively define that by getting some electrodiagnostic testing, but it's not necessary in all cases. Sometimes if somebody's diabetic or they have another potential nerve problem, a test called an EMG can help us, and that's kind of like putting a voltmeter across the battery to see if there's a charge on it. There's something that we can do medically to evaluate the nerves, and it's a fairly accurate test. It's not the perfect test, but it's really the only test we have, so we use it a lot in medicine. But really nothing beats an accurate physical examination. And if my examination matches your reports of where your numbness and tingling is, that's a pretty accurate way of making the diagnosis. And then it's just based on how long you've had the problem, what functional disabilities you may have, or the level of loss of feeling. We have people, as we see every day, and you see every day, that have completely lost feeling in their finger. They really need surgery. They've waited too long. But that's not most people. Most people get better with non-surgical treatments. And that includes an injection of steroids into the carpal tunnel area and a nighttime splint. There's a ton of other treatments out there, from chiropractic care to reflexology, to dry needling, to oral anti-inflammatory pills, gabapentin, a nerve-type medicine that I believe doesn't work. And all those treatments combined have favorable or negative reviews on YouTube or anything, but whether they work or not is up to the person. They may work on some people, but not others.
Sure.
But generally speaking, if you're losing muscle or you have constant numbness and tingling in your fingers, you need it treated by one of the known proven mechanisms. And unfortunately, there's only a few, and they include injections of steroids, a splint, or surgery.
So, if you find yourself waking up or driving or doing certain activities and find your fingers going numb, it's important to be evaluated by somebody who knows what they're talking about. And we'd be glad to do so here at Carolina Regional Orthopedics.